Hey friends and fans, Christy from Happy and Healthy TV with you guys tonight, or this morning, the way that wherever you're coming to me from, as I always say. Today we're doing a documentary video on 100 Days of a Girl with Lyme. Today is day 20. Today's topic I really felt the need to bring up because people keep asking me this question over and over again. So the topic for today is, what do you do if you get bit by a tick? I have definitely touched upon this in other videos. But I wanted to go ahead and really just talk specifically about this because so many people have, like I said, been asking me this question, especially since it's coming close to we're in the season now where ticks are just floating around all over the place. I've had people tell me they're afraid to go in the grass, they're afraid to go in their garden. So I want to ease people's concerns and then also give you some lay of the land, some tricks that I've learned since I have contracted Lyme myself. So um, tip number one, if you notice that you've been bitten by a tick, the first thing I would do is try vinegar. This is going to sound like a strange thing to recommend. Vinegar itself does not kill ticks, just so you're aware of that. However, ticks hate the smell of vinegar. So what you can do is actually take the vinegar and put it in a cup of water. So you want to dilute it somewhat. Soak a cotton ball inside that diluted water with the vinegar inside of it. I would say you want to do like, a half part water to a half part vinegar in there. So you don't need too much. And you just want to touch the rear end of the tick with the vinegar. A lot of times this will make the tick just back out and they'll decide to leave the premises. They do not like the smell of vinegar at all. So that repels them from doing that. The second thing I would do is take the tick and put it in a bag. And if your doctor decides that they want to try to flush it or throw it out, send the tick to tickcheck.com. You definitely want to check out tickcheck.com. They can actually go ahead and test the tick to see what kind of what type of Lyme bacteria that it's carrying, and or if it has any co-infection. So that's really important. So I would definitely do that. Tweezers. People ask me, should I remove a tick with tweezers? Here's the problem with doing that. If you can't successfully get the tick out with vinegar, I would just immediately go to the doctor to have it removed, to be quite honest with you. The concern with that is that the tick's head could actually get stuck inside of your body, which happened to me the first time I tried to get the tick out on my own. Um, and it took like 45 minutes for a doctor to dig the remaining portion of the tick out of my body. So pretty gross. Not a lot of fun. Don't recommend it. So, you can certainly go to a physician to have it removed. The next thing I would recommend is make sure that the doctor that you're seeing gives you a prophylactic dose of antibiotics right away. Whether or not you have a bullseye rash, or even if you do have a bullseye rash, sometimes in about 30%, um, a bullseye rash, excuse me, only shows up in about 30% of cases. So there's a very good chance you may not get a bullseye, although I've seen other bizarre rashes come from someone who has gotten bitten by a tick. So that's something to keep in mind. Please be careful with that. That is just, having a rash is not a telltale sign that there has been transmission by a tick of any type of Borrelia or other type of bacteria like Myomoti or some of the newer ones that are out there. They also would not be indicative of a co-infection, which is important. Remember, Lyme testing right now, as per the CDC, is only about 50% accurate, which means that there's a 50% chance that even if you are tested, you get a false negative. So what do you do in that situation? IGeneX Labs. I is in ice cream, G is in George, E is in elephant, N is in Nancy, X is in xray.com. Check out their website. They have the most accurate testing right now in the country for looking at Lyme and co-infections. So those would be my tips as far as that goes. Now, let's also focus on talking about prevention. How do you prevent yourself from getting bit by a tick? First of all, again, I've gone over this, but let's just, reiterate this. We're coming into the summertime months. A few things that you can do. One, if you know you're going to be in a wooded area, or if you're going to be in an area where there's tall grass or anything like that, you probably want to try to avoid those areas if you possibly can. But certainly you don't want to have to avoid the outdoors. I mean, that stinks. That's no fun. So what I would recommend to do is make sure you're wearing white clothing, especially if you're in an area like that. If you're going hiking or something like that, make sure to wear like long white socks and pull them up if you're wearing a pair of shorts. This way, if a tick does land on you, you can see it. You could definitely go ahead and spray off all over yourself. I have Deep Woods off in my trunk. I'd never take it out of the trunk. We're constantly utilizing that. Avon Skin So Soft also makes a really great product that repels ticks as well, so I would recommend that one. And it's made from Promethean. That has been proven to use that it's safe even for pregnant women, or for people who have chemical sensitivity and things like that, which many people today do. I'm not a big fan of dumping chemicals all over my body, but to be quite honest with you, I'd rather do that than wind up with Lyme disease again. So I would recommend to go ahead and take those steps if you're concerned. Another thing to keep in mind here is that ticks don't like the smell of certain things, particularly lemon. I don't know if you want to take a bath in lemon juice or something like that, but you can certainly like squirt some of it on your clothes. They, for whatever reason, it just repels them. They don't care for the smell of that. So that's something else you can try. Would I use only that by itself? Probably not, even though, I think lemons have great qualities to them and they definitely are helpful for quite a lot of things. But at the same time, it's probably not the only thing that you can go ahead and do. Let me look up that Avon Skin So Soft product for you guys, so this way I can give you guys a picture of it. Give me 1 second. So soft. Let's see. Tick repellent. What will we do without Google here? Yeah, so it's Avon Skin So Soft Bug Guard is what it's called. So that one is definitely one that you can use. I'm not affiliated with Avon. I'm just utilizing this particular product or recommending this product because it was recommended by Dr. Horwitz, who obviously, as we all know, knows his stuff when it comes to Lyme. So those are the things that I would do if I were to be bitten by a tick at this point in time, especially knowing what has happened to me since having late stage Lyme. Again, Lyme is very curable and is very much treatable if you catch it within the first few days of infection and you can get on a prophylactic dose of antibiotics. If you go to your doctor and they make not a big deal out of it, which is likely to happen, I'm just making you aware of this because of it's odd because the CDC guidelines will say to prophylactically treat someone with antibiotics. Unfortunately, a lot of physicians are not doing that at this time. I don't know why, and I'm not speaking on behalf of any physician. It just seems to be the lay of the land and the way things are going right now with that whole situation. So, that being the case, if the doctor does not want to give you antibiotics, I would definitely consult an LLMD as soon as possible, a Lyme literate medical doctor, which you can find at ilads.org. I is in ice cream, L is in Larry, A is in apple, D is in dog, S is in Sam.org. They'll refer you to up to 3 different Lyme literate doctors at a time, and they really are the gold standard when it comes to fighting Lyme disease at this point right now. Prevention, treatment, all of those things. What are some signs you have Lyme disease or that you've been exposed to a tick for a prolonged period of time? One, and this is always going to be a little bit strange because it's something that, again, because we know ticks are more prevalent in the summertime months. If you feel like you have the flu in the middle of the summer, achy joints, you're running a high fever, if you are like me and have a really stiff neck to the point where your head feels like a mannequin and you just can't move it at all whatsoever, those are signs of, unfortunately, even something as serious as Lyme meningitis, which I did have back in 2013. You definitely want to get yourself to a hospital. Could be a life-threatening situation. Not to scare anybody, I'm just being informative. You don't want to let something like that go. So that's always of concern anytime I speak to anybody who has been bitten by a tick. So remember, prevention is the first thing. Make sure you're spraying yourself either with that Avon Skin So Soft Bug Guard product, again, which is safe and for more or less non-toxic. That I would definitely recommend. It doesn't kill ticks, but it does repel them and keeps them away. Stuff works pretty well. Off is also good to use in a pinch. I would use Deep Woods Off. Remember to keep yourself wearing as much white clothing as you possibly can. Avoid areas where there are tall grass is another thing. You should not be running through, a forest full of tall grass. or I live very close to the beach, I would not be running into the dunes or in higher, well, you're not supposed to run on dunes anyway. They're protected for a reason. But that very tall beach grass is something that should be avoided, or any type of tall grass if you're going into a very grassy area. Ticks like to hang out there, and that is of concern as well. Keeping in mind, remember, mosquitoes can also transmit Lyme disease as well as sandflies. So there are other types of bites that you can get. If you do notice a weird rash or something that doesn't go away after being bit by a mosquito or bitten by a mosquito, I would have that checked out. And again, if there's any concern at all whatsoever, please just remember, guys, Lyme testing as it currently stands is not as accurate as we'd like to say. There used to be 20 different bands that would show up on a Lyme test back in the early 80s when Lyme was first discovered, back in 82 when it was first being shown as prevalent in Lyme, Connecticut. So that is something that I like to talk to people about, because for some strange reason, the CDC decided in the early to mid 90s to remove 10 bands off the test. So now you're getting a test that has only 10 bands on it. So what if you test positive for the other 10 bands? And the problem also with that is they're coming out with new bands of or different bands that would indicate what type of Lyme infection you would have every day with the current research that's going on. So that being the case, unfortunately, the current testing is just subpar. It's not where it needs to be. IGeneX Labs totally different. They do have testing that is much more accurate because it is looking for all 20 bands in addition to the newer infections and co-infections that are available. If your doctor sends you for a typical Lyme titer, let's just say you don't have Lyme, but you have Babesia or Bartonella or Ehrlichiosis or one of the other co-infections that can go with Lyme, it would go undetected. So somebody could wind up becoming very ill and just not realizing it. What kind of illnesses have been tied to Lyme disease? Like, I see this all the time, and I don't know if it's one of those situations where, we joke around about this. Like law of attraction, you buy a car and then all of a sudden you see the same model car everywhere where you've not noticed it before. I don't know if it's just because I have Lyme and I see the stuff, or because, a lot of my time is spent on support groups and or researching Lyme. But I can tell you, based on that knowledge and skill set that I've adopted over the years, that it's really important to look at other health conditions that can arise from Lyme disease. So, for example, people with rheumatoid arthritis, that's a given. Most of the funding for Lyme disease actually goes to the Rheumatoid Arthritis Foundation and not infectious disease, which is a little ludicrous and scandalous if you ask me. But that's one thing we see. But there are a whole bunch of other things: cardiac issues, lung issues, things like sarcoidosis, which is an autoimmune disease that can attack the entire body. Guillain-Barré syndrome, which many people have not heard of. My father, who ironically enough is the carpenter, landscaper, somebody who's always spent a lot of time outside, was paralyzed from his neck down when I turned 10, actually, as a matter of fact, and was told he was going to pass away from that. So it was pretty sad that wound up occurring, unfortunately, to my dad. But thank God, he fought against all odds. That must be where I get that whole thing from. Um, Tough, stubborn genes that we have. And, thank God, after spending a year in the hospital, he's, thank the Lord he's doing well, and, just celebrated his 83rd birthday. But things like lupus can be connected to Lyme disease. Neurobehavioral disorders can be connected to Lyme. So things like autism or ADHD or just other problems in general that are related to learning disabilities can be related as well. Congenital defects can be related to that. So women who are pregnant, if they are bitten by a tick, or if they already have a previous existing Lyme infection, really, really need to be extremely careful. So that's something I like to make sure patients are aware of. Um, what other health conditions are associated with Lyme? God, there's so many, like I said. And a lot of them are hard to diagnose and to treat. So we really like to pay attention to all of these factors. They're very, very important. So there are, like I said, again, tons of health conditions that can be related to Lyme. chronic fatigue syndrome. Nobody's ever figured out why people have that. As a nutritionist, I could tell you there's a million reasons somebody could have chronic fatigue, but if you do suffer from that and it's debilitating, you might want to have that checked out too. Different issues with the autonomic nervous system, for example, having trouble with tolerance to extreme heat or extreme cold. Now, if you're like me, a couple of summers ago, I used to go running with, like, I'm not even kidding you, like 3 sweaters on, and I would just, like, thermal sweaters, my Nike sweaters. I would just not even be cold, or I mean hot rather, excuse me. Uh, Not at all. I would just be comfortable. I was fine. Then again, stick me in a cold environment. Oh my God! If it's anything less than 60 degrees out, everybody that knows me laughs at me because I'll be wearing like a jacket in like 90-degree weather. I'm not even kidding. Down in Florida a couple years ago, and my best friend had made a comment. You're the only person I know wearing a denim jacket over your adorable, cute little dress you have on, while you're down in Disney World in crazy humidity. The flip side to that can happen too. I've seen people that just don't do well with extreme heat or extreme cold. And my body has kind of turned into that as time has gone on. Um, I find if I'm in extremely warm temperature now, which makes me so sad, I have to make sure that I'm nearby a pool or some sort of water source so I don't overheat, so to speak. I'm like a car that overheats itself or something. Maybe I need uh, coolant or something or some sort of fluid, if anything. Pun intended, I guess, while I'm drinking my water. So, yeah, those are all things to look out for. So, those are the steps I would take immediately if you are bitten by a tick. I really would be wary of removing a tick myself, to be quite honest with you, because again, if the tick's head gets stuck in there, that's a major issue. If you find a tick crawling around your bathroom or you find a tick indoors, the best thing to do is to take the tick and just flush it down the toilet as soon as possible. Do not try to attempt to crush the tick. You do not want to get any of what is, God forbid, on that tick inside of you. Uh, Staying away from woodland creatures like poor deer, unfortunately, are hosts for ticks. So I would definitely refrain from going anywhere near those guys. In addition to, uh, some people are just naturally attract bugs. It has to do with our genetics and then also with a lack sometimes of B complex vitamins, believe it or not. So if you're one of those people that's like goes outside and gets eaten alive by bugs, you really need to be careful. A tick is probably more apt to land on you than the average person. But at that point, too, I'm also going to say you sure as heck should not stop living your life just because these little buggers exist and they're floating around. Certainly be careful and be on the lookout for them. But I certainly, even me with going through what I've been through, I don't spend time obsessing over the little critters. They're around, they're going to be around. Ticks do not fly, they jump and then they kind of float around and land on things. So that's the way that works out. So if you see a bug that has got wings on it or any other weird thing like that, it is most likely not a tick because again, ticks cannot fly. So that's important to be understanding about that or have that understanding as well. Yeah, so I basically, guys, went through most of my tips there. So, tickcheck.com, IGeneX, find an LLMD if you do get bit. Do not wait I would not recommend waiting after you got bit by a tick. Uh, Ticks can transmit uh, bacteria within as little as a couple of hours of biting you. Longer the tick is on you, the more susceptible that you are to winding up with an infection. And again, there are people that have Lyme disease that lays dormant. They may test positive on an ELISA or fish test, which is a standard test for Lyme, again, which is only about 50% accurate. But that really, again, as we've talked about, doesn't mean much. At the same time, you have to look at somebody's overall immunity. If you're already predisposed to have an autoimmune problem, you are more likely to wind up with issues there. If you're under an extraordinary amount of stress, that can also play a role with things. Um, so you've got infection, immunity, and previous infections. If somebody is MTFR, MTHFR gene positive, that can affect things as well and cause more of a Lyme infection. Epstein-Barr virus has been linked to Lyme as well, although like 90% of 99.9% of the population has that. It's such a common uh, virus that's picked up. So, it's really, they're all things to take a look at. So if you get bit by a tick, please follow my little checklist there. And again, prevention, best thing, but unfortunately, you can't prevent everything. Making sure that as soon as you get home, you're checking yourself for ticks, or as soon as you go anywhere where you've been outdoors. Shoot, you can even get a bit by a tick indoors. If you have pets, I have my kitty cat here who spends most of her time inside. Every once in a blue, I'll let her outside just so she can have some fresh air and whatnot. But that doesn't mean anything. If you have a dog, you're taking it out for a walk, or he or she, you never know. The dog could get bit by a tick, bring a tick in. Dog ticks do not, per se, carry Lyme bacteria, but that's not to say research in the next couple of years won't come out saying otherwise. I also find it very strange because I had to take my cat to the vet a couple of times over the past few weeks. Thank God she's doing better, but or a little better. There goes her tail in the background. She knows I'm speaking about her as usual. Uh, a vet will pay more attention to this than anything else, as far as Lyme disease goes, which I find crazy. So they actually treat pets better than they do humans with Lyme. So that's got to change. I mean, not that we shouldn't be treating our pets fantastically, but I think that is kind of freaky. The last time I had taken my cat to the vet, there's a huge sign in there, beware of Lyme disease, this can kill your pets. Why are there not signs like that in a doctor's office? Not that you want to alarm somebody, like, but why would they have warning signs on places? Oh, beware of ticks. Obviously somebody knows something about this. And so the CDC is just, more and more cases are coming out with this, and the research is there. So please, guys, be careful. Enjoy your summer. Enjoy the rest of the springtime. If you guys are coming to me today or later today, happy Mother's Day if you celebrate. And I hope that everybody enjoys the rest of their day or evening wherever you guys are coming to me from. And I hope that this video was informative to you. Everybody take care, and thank you again for watching. Love you guys. Bye.